Welcome everyone to CanWaCH learning session. We're joined by Miriam Nkengu and Patrick Okwin joining us from Cameroon to tell us about the Born Fine project, which is supported by Grand Challenges Canada, funded by the Government of Canada and Global Affairs Canada, and implemented in Cameroon by the WHO Collaborating Center for Knowledge Translation and Health Technology Assessment and Health Equity from the University of Ottawa, in collaboration with Effective Basic Services, or eBASE Cameroon, and the Ministry of Public Health at the district level in Cameroon. So to offer some background on our guests, Miriam Nkengu is a PhD candidate in epidemiology at the University of Ottawa, interested in RMNCH with over 6 years of experience working with rural communities on MNCH. She's a Grand Challenges Canada innovator, leading the Born Fine project team with research interests in cyber health, evidence synthesis, and implementation. Dr. Patrick Okwin is the District Medical Officer of Bali in Cameroon and the team lead of Effective Basic Services, eBASE, Africa. He's passionate about using innovation and best practices to improve livelihoods, especially for underserved populations. We're also joined by Janet Hatcher-Roberts, one of the co-principal investigators with the WHO Collaborating Center for the project. So now I'm going to turn the mic over to our guests to walk us through part one of this two-part session, which illuminates their experience with successful partnership building in a fragile context. So over to you.
Thank you very much, Leah. My name is Patrick. In this session, we will be talking about partnership building in geospatial data and fragile settings with experiences from Cameroon. As I progress through the slides, Miriam and Janet can come in as need be to add value to the discussions. So today, the learning objectives include increasing awareness on reproductive, maternal, neonatal, and child health and gender-based violence situation in Cameroon, understanding the role of geographic information systems and how it can play in better understanding geospatial aspects of the data for decision-making in gender-based violence using the quick click, and challenges in implementing reproductive, maternal, neonatal, and child health projects in conflict settings like Cameroon, and how we cope with these challenges. And we'll also be looking at partnerships, developing partnerships strategies that we have used in the past. Specifically, we would like to highlight what are the challenges in reproductive, maternal, and child health in fragile settings. How did we use geospatial data with the Tamunde project to address challenges with reproductive, maternal, neonatal, and child health? And what the team success in partnership development, including how we managed the gains that we had in the process, the change. So challenges that we've faced in the past in working in fragile settings, and especially for reproductive, maternal, neonatal, and child health, included collecting data in fragile settings. It's challenging because community members tend to distrust any individual coming from the outside when there are issues, when there is conflict, or when there is a natural disaster. In conflict settings, oftentimes hospitals and villages are burned by warring factions. This could be by one party or the other, or someone who is trying to hide some things. So this usually happens, and it's very common. We found this quite often in Cameroon. There is also difficulty in moving project and research teams around due to insecurity. You need to go collect data, but there is fighting in one area, so you are unable to go there. Our experience is that every day is different, and we needed to get security clearance from all warring factions on a daily basis. You also find out that healthcare workers may also be unable to go to the hospital. So in some instances, health personnel in our teams will have to provide certain services. Most patients who are displaced from their villages, when the villages are burnt or when fighting escalates, become victims, especially of poverty. Poverty increases because people are unable to work, either do their farm work or their normal businesses. Now, in using mobile phone technology is a huge way to get around these challenges, as it allows for remote monitoring and location of beneficiaries. BornFind app was used in combination with other programs, other computer-based programs, to collect and manage data. Every day is different, as I said earlier on, with its own insecurity risks and its own security arrangements. And staff are expected to follow strict security advice, which we develop in collaboration with humanitarian organizations like UNHCR. Empathy with community members is key in building trust in communities. Consulting relevant stakeholders, for example, the military or the rebels or other humanitarian stakeholders on the field, is very important. This helps us to gather information on the field as to areas that are dangerous to go to or areas to avoid. We also use the mobile money platform, which is an approach whereby you send money to people through their mobile phones. So we can pay hospital bills or bills for anyone who helps us to do some work on the field using mobile money. Therefore, we don't need to go to the area to pay money because in most of these villages, there are no banks. So it therefore reduces physical exposure to danger. And the mobile money was a very good tool for us to use in this setting. On this slide, we would look at a typical geospatial data display that can assist a decision maker in allocating resources for training or to reallocate supplies or sensitization programs. It shows the friendliness of sexual reproductive health service providers to young girls who are requesting various products like condoms, emergency pills, or medical abortions. So we notice that friendliness wanes from condoms to medical abortion. It means that when you look at the slides as they move, the medical abortion's friendliness, the red balloons show where there was no friendliness to the young girl who went to purchase medical abortion. And the green ones show where she had a good reception and they were ready to sell this to her. The same thing with the condoms and the same things with the emergency pills. So with this now, a decision maker can actually identify areas in which he may need to physically supply condoms in order for young people to access them, because those who are selling them are not ready to sell this to young people. On this slide, we look at an example of a geospatial or a cyber health technology that we used in another project that was funded by UNFPA in the northern parts of Cameroon, in Lagdo specifically. And this was also another conflict zone. And this project, we called it Tamunde, which means hope. And the project had sought to increase access to emergency obstetric care and also reduce the 3 delays. In this project, we work with community health workers, government officials, and traditional leaders. And we can see that a woman in distress will activate a system which facilitates geo-referral from a GPS-powered ambulance, which was also donated by UNFPA. So in the schematic, we can see a woman in distress who activates a health line. The Tamunda server immediately alerts the doctor, the driver, and the midwife through a text message that there is a woman in distress at this particular GPS location. The driver immediately sets off with the ambulance to go pick up the woman, guided by the GPS in the car. And the doctor, the midwife, and the pharmacist, they already start moving to the hospital to wait for the woman. This significantly reduces waiting time, takes away the barrier of transportation, which is very common in Africa. And in this particular case, you can see a case that we experienced on YouTube, which is in the annex of the slides. And in this case, we actually delivered a 4.4 kilogram baby to a woman who had lost 2 previous babies, and this was her first baby. In this project, we actually were able to reach out to 520 women. I will hand over to Miriam now to continue on this slide.
Thank you, Patrick. So yes, our partnership development strategies has been built on trust. and sharing common objectives and vision. Specifically with the Born-Find project, the key element was identifying strategic and relevant stakeholders. So for example, Dr. Okwen is a practicing physician in Cameroon. He understands the context, the health system. He has worked on several maternal newborn child health projects, especially using mHealth. And most importantly, he has a decision-making role as a district medical officer. So this also goes same with our app developer for the Born-Find. He's passionate about improving the lives of vulnerable. So based on this trust, over the years, we have been able to use our existing networks to collaborate with other stakeholders and engage through intersectoral collaboration. So this process involves constant discussion and update on relevant information, negotiating with potential partners. And I would like to bring in Patrick again so he can throw more light on a few aspects of partnership from his own perspective.
Okay, thank you again, Miriam. So we build partnerships through different tailored approaches. It's not a one-size-fits-all, but trust and hard work within shared visions plays the trick. We have developed and maintained partnerships with government and networks are very useful. Experiences that partners live together, including heartbreaks and happy moments, build strong relationships over time. Conferences are helpful for partnerships as well. A story told at the coffee break or a business card shared at dinner are good starting points for partnerships. For example, at eBASE, we've been able to create lots of partnerships at conferences, including partnerships with organizations like Education Endowment Foundation, University of Ghent, and the Joanna Briggs Institute. So, Miriam, maybe you talk about the links we have here in the appendix.
Okay, so I will just give you our contacts. Here you have Effective Basic Services. So you can see the website and the email address and the Twitter handle. And look, just like Patrick said earlier, you can always watch the Tamunde YouTube through this link. You also have the Born-Find project website and the email address and our Twitter handle. Slide. So we would like to thank our partners for this project, especially the WHOCC Systems, which is the app developer. You have MinSante, that's the Ministry of Public Health, the World Solar Fund, they support with solar chargers, and we have Orange as well. And then the YEMS group is our graphic designer. Thank you. Slide. So you find our contacts here. So you, Miriam, that's my email address and my Twitter handle. And Dr. Patrick Okwen, you can find his email address and his Twitter handle. So thank you for watching and hope you enjoy the presentation.
Wonderful. Thank you so much for sharing your experience and knowledge with us. Before we wrap up this session, I'd just like to ask a follow-up question. So this project obviously required strong and collaborative partnerships with academic institutions. So many of our members at CanWaCH are keen to establish working relationships with academic institutions, but it's difficult to know where to start for some organizations. Based on your experience from this project, what are your recommendations for starting and maintaining long-term relationships with these academic institutions?
So, Miriam, I would go ahead with this first.
Yes, you start with this.
Okay, then you can add up. So, coming from the development aspect, because we had this collaboration with the University of Ottawa, WHO Center for Collaboration on Equity, Knowledge Translation and Equity. one of our biggest challenge was striking a balance between the development expectations and the research expectations. The objectives tend to lead to the same place, but sometimes they are quite conflicting. For example, the development agency or the development worker will want to see as many people as possible benefiting from something that they think is working. However, the researcher would want to see the quality of evidence. So you would see them strongly insisting on having randomized controlled trials. Some people will have the intervention and some will not have the intervention. And this is quite challenging for the people from the development side when they feel that, okay, but this intervention already shows that if a woman has this app on her phone, it really can save her life. So why don't we give everybody? Why do we have to deprive some people of it? So striking that balance was particularly challenging for us. Miriam. Maybe.
Okay, so another thing I would like to add on partnership from the university perspective is normally with a grant challenge grant, before you submit for the grant, you need to get collaborators. So that's already a good start point. And like I said earlier, is you have to be strategic in getting your smart partners. And I already outlined some of the criteria that we use to identify the partners that we would work with. Because you want to have a vision, you just don't want to do a proof of concept, but you're looking forward like scaling up. So you want to partner with people that can push the agenda forward. For example, like I already said, Dr. Okwen is a district medical officer. That's already strategic to start a project one district at a time. And then also, I earlier said, you need to also have projects to implement in order to build relationship, because if you don't have the projects, you will not be able to learn from the partnership and to build a stronger relationship. There will always be challenges for sure, but what is important from my experience is that transparency and the vision that is, you have common goals and objectives. So despite the challenges, because you have a vision that clicks together, it overcomes whatever challenges that comes your way. And specifically, I would like to say from my own personal experience as well, is that the aspect of getting this collaboration, it's already one starting point, like a condition for you to get a collaborator in the implementing country. It's already a very strong start point. I would like to invite Janet on this to throw more light.
Yes, I think the other point, and I link back to Patrick, is that one doesn't always have to go right to the randomized control trial, although that's one way of looking at whether an intervention is effective. And by partnering with universities, and I know at our collaborating center, we have a number of experts that mix their methods. And so by mixing the methods, we're able to come up with an approach that encourages the development workers and the communities to understand what's going on, but also to have some other measures of effectiveness and uptake and compliance, etc., that allow us to gather the evidence so that it makes it all more acceptable in the long run. So that I think it's the continuum of evidence that a university partnership can bring, and specifically organizations that have this expertise in place, such as our collaborating center, but there's other universities as well. And I might say that this is something that we've been encouraging for over 20 years, is to have the NGOs link up with universities right from the very beginning of a project to understand what might be the evaluation process and the evidence that they need, and what are the questions that the NGOs have at the end of the day to make their work more effective. So it's something that we all welcome very much, and hope for future collaboration. Thank you.
Great, thank you so much for those insights. So I just wanted to thank you, Miriam, Patrick, and Janet. And for members who are watching this session and would like to know more about specific technical aspects related to the project and to geospatial data, the randomized control trial, and mobile applications, you can find part 2 of this series on the CanWaCH website. Thanks.